Hello everyone, welcome back to my channel. If you're new here, I make videos about life in the Philippines, including what it's really like for expats living here long term. Now let's be honest, one of the biggest concerns that foreigners have about moving overseas isn't just cost of living or visas, it's health. What if you get sick? What if you need medicine? What are the risks of living in a tropical country like the Philippines? In today's video, I'm going to break down the 10 biggest health problems in the Philippines and explain how they can directly affect expats. I'll also share some tips on how to avoid them and what you should do to protect yourself if you're planning to move here. So let's get into this soon. My name is Mike. First on the list is heart disease and hypertension. Heart disease is the #1 cause of death in the Philippines, just like in Western countries. High blood pressure, high cholesterol, poor diet, and smoking are major contributors. For expats, the challenge is twofold. First, Filipino food is delicious, but a lot of it is fried, salty, or loaded with sugar. Think lechon, chicharon, and halo-halo. If you're not careful, your blood pressure and cholesterol can skyrocket. Some medical checkups and maintenance medicines are available, but not always as cheap or as accessible as back home. If you already have a history of hypertension or health problems, you'll want to bring your prescriptions with you and get established with a local doctor early on. Regular monitoring is a must, and yes, there are good cardiologists in many major cities, but rural areas often lack specialists. Okay, so now let's talk about diabetes and obesity. The Philippines is experiencing a rapid rise in diabetes, mostly due to diet. White rice is eaten 3 times a day, sugary drinks are everywhere, and desserts are a huge part of the culture. As an expat, it's very easy to fall into the trap of convenience foods and sweets, especially if you're retired and enjoying life. But uncontrolled diabetes can lead to kidney disease, blindness, and even amputations. Healthcare-wise, insulin and medications are available, but imported brands can be expensive. Monitoring equipment may also be more limited than what you're used to. For this reason, if you're a diabetic, you'll need to budget for higher medical costs. The good news is, fresh fruits, vegetables, and seafood are available here. If you maintain discipline, diabetes can be managed. But for many foreigners who struggle because of the food culture, it makes it hard to say no. Okay, so now let's talk about TB, tuberculosis. Tuberculosis remains a major health problem in the Philippines. The country is considered one of the top 10 high-burden TB nations in the world. Why should expats care? Because TB is airborne and spreads easily in crowded areas. If you spend time in jeepneys, crowded markets, or even some hospitals, you may be at risk for exposure. Most foreigners from the US, Canada, or Europe never really think about TB because it's rare back home. But here it's common, and treatment requires months of antibiotics. If you have a weakened immune system or if you're older, you're at greater risk. Expats in close quarters in urban settings with poor ventilation need to be especially cautious. Getting tested regularly, especially if you've had a persistent cough, is a smart move. Also, private hospitals tend to be safer and have better conditions compared to some government facilities. Now let's talk about dengue fever, one of the most common tropical diseases foreigners encounter. Dengue is spread by mosquitoes, and outbreaks happen every rainy season. For locals, dengue is just part of life, but for expats, it can be a nasty surprise. Symptoms include high fever, severe body pain, rashes, and in rare cases, it can be deadly. There's no real cure, only supportive care. And here's the problem. If you're far from a decent hospital, your condition can deteriorate quickly. Expats in rural provinces are especially vulnerable because advanced care isn't always nearby. Prevention is the key. Sleeping under mosquito nets, using repellents, and avoiding stagnant water around your home can reduce your risk. Many foreigners who move here underestimate dengue until they get it. Trust me, it's something that you want to avoid. Okay, COVID-19 and respiratory illnesses. While the pandemic has slowed down, the Philippines still deals with COVID-19 and other respiratory illnesses like pneumonia and influenza. Air quality in cities like Manila and Cebu is often poor due to traffic pollution and making conditions worse for people with asthma or lung issues. Expats who already have respiratory problems should be cautious about living in highly urbanized areas. Long-term exposure to smog can trigger chronic breathing issues. Vaccines are available, but sometimes supply runs low. Also, public hospitals can get overwhelmed quickly during outbreaks. If you want reliable care, you'll likely depend on private hospitals, which cost more. Simple precautions like wearing masks in crowded areas, using air purifiers in your home, and avoiding heavy traffic zones can go a long way toward protecting your lungs while living here. So now let's talk about kidney disease. Chronic kidney disease is a growing issue in the Philippines, often linked to diabetes and high blood pressure. The sad truth is that dialysis centers are full and many Filipinos can't afford long-term treatment. As an expat, if you develop kidney problems, you may face a challenge. While dialysis is available in larger cities, smaller towns may not have facilities. Plus, the cost, if you don't have insurance, can add up quickly. Some foreigners choose to fly home for treatment because the level of care in provincial areas isn't enough for long-term management. If you're already at risk for kidney disease, it's crucial to stay on top of your diet, monitor your blood sugar, and get regular lab work. This is one of those silent health issues that can sneak up on you if you're not careful. Okay, now let's talk about liver disease, hepatitis, and alcohol-related diseases. Hepatitis B is widespread in the Philippines, and many locals don't even know they're carriers. For expats, this means a risk if you need blood transfusions, tattoos, or any kind of invasive procedure. On top of that, alcohol is cheap and widely available. Good thing I don't drink, but many expats do, and some fall into heavy drinking after retirement, which increases the risk of liver cirrhosis and fatty liver disease. Medical treatment for liver problems is available, but advanced care can be limited outside major hospitals. If you're a drinker, or if you've had hepatitis in the past, this is something that you want to be very cautious about. Getting vaccinated against hepatitis before moving here is a smart step. And if you're going to drink, pace yourself. Too many foreigners cut their lives short in paradise because they couldn't resist the cheap beer and rum. This next one should be the biggest concern of them all. If you're a single guy coming here to the Philippines to either retire or just to have some fun, the concern is HIV and other STDs. HIV is rising in the Philippines, particularly among younger people. For expats, the concern comes if you're engaging in risky behavior like unprotected sex or casual encounters. Unfortunately, there's a stigma around here, which means many cases go undiagnosed. Testing centers do exist, but not everywhere. And while antiretroviral treatment is available, it may not always be as consistent as in Western countries. Other STDs like syphilis and gonorrhea are also present. For expats who plan to date or marry a Filipina, it's important to have open conversations about health and to use protection. Remember, your health system safety net here isn't as strong as it is back home. One careless mistake can become a lifelong problem. So now I want to talk about those sex tourism types of men who travel to the countries like the Philippines and Thailand and book their hotels right in the middle of red light districts. In many parts of the Philippines, sex work does exist, whether openly in nightlife districts or more discreetly in smaller towns. And here's the hard truth. Some sex workers may offer to skip using a condom if the client is willing to pay extra. On the surface, that might sound tempting to some men, but what's really happening is a gamble with your own health and possibly your life. The Philippines is currently facing a growing HIV epidemic. In fact, it has one of the fastest rising rates in all of Asia. Alongside HIV, there are other sexually transmitted infections like syphilis, gonorrhea, and hepatitis. Many people who are infected don't even know they carry the disease. For foreigners, this means one careless decision, one night without protection, can lead to a lifelong problem. And unlike back home, access to consistent treatment and medication isn't always guaranteed. You don't want to spend your retirement years paying for something that could have been avoided with a simple choice. And here's the takeaway: always use protection. Don't let a little extra money cloud your judgment. Your health is worth far more than any risky encounter. Also, if you're a sex worker in the Philippines, always insist that your customers use condoms. No exceptions. The AIDS medication enables you to live longer, but it can be expensive. Okay, so now let's talk about motorcycle and traffic accidents. Now, this might surprise you, but traffic accidents are one of the biggest health risks in the Philippines. Roads can be chaotic, infrastructure is inconsistent, and motorcycles dominate the streets. For expats, riding a motorbike seems like the ultimate freedom, but it's also one of the quickest ways to end up in the hospital or killed. Helmet use is often ignored, and medical response times can be slow. If you get into an accident in a rural area, don't expect an ambulance to arrive quickly. In fact, most people are just thrown into the back of a tricycle or a pickup truck and taken to the nearest clinic. If you're planning to drive here, get good international health insurance, always wear a helmet, and understand the risks. A bad crash here can wipe out your savings and change your life forever. I've chosen not to drive here in the Philippines. Mental health issues. And last but not least, let's talk about mental health. Many foreigners move to the Philippines expecting paradise, but reality doesn't always match the dream. Isolation, cultural differences, and lack of family support can lead to depression, anxiety, and even substance abuse. Mental health care is still underdeveloped here. There are some psychiatrists and therapists in big cities, but stigma is strong, and resources are limited compared to Western countries. For expats, it's important to build a support network, friends, expat groups, and online communities. Staying active, eating well, and finding purpose in retirement are critical for mental well-being. Many foreigners ignore this issue, but it's just as real as any physical disease. So those are the 10 biggest health problems in the Philippines and how they affect expats. To recap quickly: heart disease, diabetes, tuberculosis, dengue, respiratory illness, kidney disease, liver problems, HIV and other STDs, traffic accidents, and mental health challenges. Now, don't let this list scare you off. Millions of foreigners live happily in the Philippines. The key is awareness and preparation. Get insured, build a relationship with a reliable doctor, and take preventive measures seriously. Living in the Philippines can be an amazing experience. Your health is your greatest asset. Protect it, and you'll be able to enjoy everything that this country has to offer. If you found this video helpful, don't forget to hit the like button, subscribe, and share with anything thinking about moving here. And remember to click or tap the bell notification. Thanks for watching, and I'll see you in the next video.